Hello again. I'm Dr. J.C. Smith here in wonderful Warner Robins, Georgia. Today I'd like to talk to you about a conclusion I've come to after 42 years of working with people with bad backs, my own included. I've had 4 serious back injuries, and learning how to manage my own problems and that of thousands of patients here in my clinic, I've come to a few conclusions. First of all, people just don't know what the hell a back problem is all about. They're still locked into the outdated concepts, as the European researchers call it, widespread misconceptions, that everything's a pull muscle or a slip disc. So you take pain pills and muscle relaxers, or you have disc surgery. Well, that is outdated models of care that have been thrown out, but they maintain in the public's consciousness because they keep hearing that from uneducated medical doctors who know nothing about the spine. Physical therapists are also antiquated with pull muscles and all that old stuff. And of course, the greedy spine surgeons who are making boatloads of money doing unnecessary surgeries. There are ethical spine surgeons and researchers saying as much as 50 to 90% of all back surgeries are unnecessary. But in your case, you need it. That's how, and they do this fear-mongering. If you don't have my surgery, you're going to die. If you go to a chiropractor, he'll kill you. It's amazing how they scare people into these surgeries. An average back surgery, according to the Mayo Clinic, is around $80,000. And that's just a single level. If you do multiple levels, and if they do all the hardware that they put in there, it can go up to, I've heard of neck surgeries and back surgeries reaching $250,000. And of course, as one surgeon said, it leaves a wake of disability behind. These things don't work. The fact is, you don't pull muscles, you don't slip discs. Pain pills, muscle relaxers, epidural shots, and back surgeries are not needed in 90% of cases. Most people, yours and mine, have biomechanical problems with the spine. Again, keep in mind the spine here is a weight-bearing column. Now I have to admit, it's not a very good one. Think if your legs had 24 little vertebrae. How stable would your 2 legs be? Not very stable at all, right? So, because your legs just have 2 major joints, 2 major areas, right? The bones. But nonetheless, when you have a back attack, it's not just a simple thing like a pull muscle or a bulging disc or a pinched nerve. It's a mechanical problem of your whole spine. They've done a lot of research on this, but this research isn't getting to the public because it doesn't support the medical model of pain pills, muscle relaxers, and back surgery. But it's a matter of the fact that your spine's a weight-bearing column, just like your legs bear weight. And the joints of the spine are not ball and socket, which bear weight well like your hips. These joints are gliding joints. You can see them here when they move. Let me use my fingers. It's a gliding joint. It's not ball and socket, it's a gliding joint. In most vertebrate animals, their spines are a beam. So these joints allow for a little rotation, a little flexion, and that's about all. But we decided to evolve as human beings. Suddenly these gliding joints became weight-bearing. And then you get into the fact that they start buckling. John J. Triano, a very famous chiropractic educator researcher, did a lot of study of this at the Texas Back Institute, where they actually put weights on people's shoulders until the joints actually buckled. They call it a creeping effect, where they just get more compressed, and finally you cough or sneeze and boom, they buckle. And that's when people come to see me and they go, but all I did was sneeze, and now they have a serious back attack. But when we take x-rays of these people, we don't find just a buckled segment. That's just a part of the problem. We find terrible misalignments in the spine, and we find pelvic imbalances, all kinds of distortions. And then, of course, we find this sort of degeneration, which tells me that has been brewing for years. One study said that 3/5 of adult problems actually begin in youth, when kids fall off bicycles and roller skates, play sports, football especially. For girls, cheerleading and gymnastics are the killers. So these kids, when they're 5, 10 years old, they fall and jar their low back, but kids heal quick. And mom thinks, oh, she's okay. And then 10, 20, 40 years later, they come to see me and they said, but all I did was cough and my back went out. We'll take an x-ray and find this huge scoliosis or bad misalignments, what we call the subluxation. We find all these degenerative processes, which tells me it's been going on for years. I tease these patients, said, imagine if you had never been to a dentist by now, how bad your smile would look. Well, that's the kind of spines we chiropractors see every day. But we don't simplify it down to just a thing. You have a subluxation. You have that and a lot more. You have a pulled muscle. You have that and more. You have a herniated disc. Yeah, you have that and more. Again, the disc doesn't herniate because it wants to. It only does when it's mechanically overloaded due to the misalignments. Imagine your knee joint. Instead of being straight, what if you had a kink in your knee? You couldn't bear weight on it. And again, the soft tissues swell, and then but they don't go in there and just cut out the disc and leave it misaligned like they do with your back. They don't straighten your back when they do surgery. They just fuse it as they find it. The reason why discs degenerate is another interesting phenomenon. A lot of it, again, has to do with the fact that, think of your disc as a big sponge, fiber with mostly water. First of all, I've learned most people don't drink near enough water during the day. You're supposed to get 30 to 50 ounces daily. And then if you drink dehydrating beverages like coffee, Cokes, alcohol, it's going to cause the dehydration of your disc even more. So you could technically have the straightest, prettiest spine in the world, and if you dehydrate your discs, they start degenerating because there's just not enough moisture in there. A lot of the new tables we have, the high technology tables, the Leander stretch tables, the DRX decompression tables, their goal is when they pulsate, they're going to decompress the disc and the joints, but also it allows water to be reabsorbed into the disc space so they can regenerate the disc height as well as eliminating the back pain itself. But then you're not out of the woods. You can get treated in offices and get partial results to some degree, but then you still have to stabilize your spine. And this is the hard part because only you can stabilize your spine. Believe me, I do my back exercises every day. I have a little gym in my garage. I kick my car out and put my tables in there, my weights in there. And I have to work out every day or else I can't adjust some of the bubbas that come in here. And believe me, they're getting bigger every year. It's amazing how obese Americans are now. And you don't think that has a compounding problem with your back? Again, your spine's a weight-bearing unit. Imagine right now if I were to put a 50-pound bag of dog food on your shoulders and say, all right, walk around with that all day long. How do you think that's going to make your back feel? Not a lot better, is it? And the same if you sit all day. Sitting, as passive it is, actually compresses the spine 40% more than standing. There's been research done on this. And then if you start loading it, then it's going to compound that. So again, you have to learn that you just can't ignore your spine and then when you have a back attack, go seek some kind of professional help. And that's not going to work. That's like, again, like never brushing or flossing your teeth. And then when you have a toothache, you run to the dentist thinking his drilling your tooth is going to make it all better. No, it may momentarily stop the toothache, but the dentists have been successful, or I should say the toothpaste companies, in teaching Americans how to take care of their teeth. And it's a daily effort. You don't just brush your teeth when you're in pain, do you? You do it every day, probably 2 or 3 times a day if you're like most people. But nonetheless, people just have no idea that you have to take care of your spine every day, especially if you had childhood injuries that have now evolved in degenerative state. If you sit all day, or if you work at a labor job all day, you're really wearing out your back. And is it any wonder why 90% of Americans have back attacks? They don't know how to take care of them. They do no preventive things. Most of them go off to the medical world and have the drug shots and surgeries that don't work. Actually, it was the back pain opioid drug epidemic that caused it, the opiate pandemic that we had before COVID became the big issue. It was opioids. And again, they found most people are taking opioids for neck and back pain. But opioids don't fix you. Most people don't even know an opioid pain pill like Tramadol and Oxycontin and all that stuff. It's no more effective than 2 ibuprofen. What the active ingredient that people take it for is it's medicinal heroin. So they get high from it. That doesn't fix you of anything. It actually leads to addiction. Don Teeter, the former medical doctor in charge of a U.S. drug agency, he said opioids don't kill pain, they kill people. And they're absolutely worthless. How can a drug, whether it's a pain pill, over-the-counter, prescription, or epidural shots, or even surgery, how does that fix a mechanical problem with your spine? It doesn't. You can't realign a spine, restore joint motion. by taking drugs. Imagine if you twisted your knee badly. Would you accept the doctor say, oh, we're going to give you pain pills and muscle relaxers and that's it? If that doesn't work, we're going to do epidural shots. If that doesn't work, we're going to fuse your knee in the misaligned position. You wouldn't accept that. So why do you with the spine? Most people don't realize, first of all, that the spine even has joints that can misalign or get compressed or buckled. But in fact, there's major joints, synovial joints. There's 137 of them according to those who count them. But when you add in all the joints that attach to the ribs, from the ribs to the back, it's over 360. So there's a lot of joints in your spine. So when you have a back attack, you're not slipping discs, you're slipping joints. That's why manipulation, traction, massage therapy, yoga, any kind of stretching, what you're doing is you're restoring joint motion, and that's what makes you feel better. But when these joints get locked up, then you've got a back attack. Like I say, again, theoretically, you can have the straightest, prettiest, strongest spine in the world, but if you sit all day, it's just going to compress. And again, what do? You have to unlock them. That's what our tables here and the DRX and adjustments can do. But even then, you can't stop there. You've got to start doing home exercises. Now, every patient who comes to my clinic gets easy to do back exercises that take less than 10 minutes to do. Can you spend 10 minutes a day learning how to take care of your spine? Is it worth it to you? I think it is, but most people wait until they're disabled or after the 2 or 3 back surgeries. We see a lot of that in here. Warner Robins must be the back surgery capital of the state of Georgia. It's really tragic what they're doing to people. And the thing is, none of the guidelines recommend drug shots and surgeries. Those are the last resorts. What they recommend are what they call conservative care, which doesn't mean right-wing politics, although you might expect that here in Warner Robins. No, it has to do with non-drug, non-surgical. And that's what we do. That's why all the guidelines put chiropractors at the top of the list as the first frontline treatment. Unfortunately, as we've learned, the medical profession doesn't follow guidelines, they follow the money. And the money is drug shots and surgeries. And you're the victim, you're the pigeon, you're the mark that they're going to go after and lie to you about, oh, you got a bad disc, that means you need surgery. In fact, there's a Mayo Clinic did a study on these bad discs, and they found that there's a simple rule to go by. By the time you're 20 years old, 20% of Americans will have bad disc but have no pain. By the time you're 50 years old, 50% of Americans will have bad disc, but they have no pain. And by the time you're 80, 80% of Americans will have bad disc, but they have no pain. Again, a bad disc is just secondary to the mechanical overloading. If you realign the joints and strengthen it, that pressure on the disc will die down and they can actually re-heal if you take enough water and do these flexibility exercises. And even if they don't re-heal because they're too far gone, you can still stabilize the spine. Even if you've had back surgery, you're not out of the woods. That back surgery, again, most of the part isn't even necessary, and those people are worse off than before. But we have hundreds, if not a few thousand failed back surgery victims come to see us. We adjust the joints above and below it, and they feel a lot better. Now, they're always going to have troubles where the surgery was, which is like a controlled injury. You're still going to fill up with scar tissue, and it leaves you in a misaligned position, so you're not out of the woods. But nonetheless, we show our patients. So if you want to learn how to take care of your back attack, come in, we'll analyze your situation and give you the best help that you need. Otherwise, find a good chiropractor in your hometown, because I know our videos are seen all over the world, and we encourage you to go into any good chiropractor that has the proper equipment. Not all of them do. Not all chiropractors are the same. So find someone who has the specialized table and technology like we have, and you'll get the best results possible if you're a good patient who does their homework, who does your exercises and watches your posture, don't sit all day, and lose weight. That's the big thing. Rehydrate your body. Start drinking water rather than Cokes, coffees, and crap. Nonetheless, thanks for being a good audience. I'll talk to you next time.